Good morning or good afternoon, folks. Judge Executive Al Mattingly here, getting ready to give you an update on COVID, our weekly update. I appreciate you joining us. First of all, let me remove the mask. You know, in past for 13 months, I guess, I've been talking about mask being the best defense against you contracting COVID. And someone was listening to me last week and said, hey, you're wrong. And they're right. Now a fully vaccinated person, in other words, getting your 2 shots or your 1 shot from Johnson & Johnson is your best defense. It doesn't mean that you throw the mask away, quit washing your hands, quit socially distancing, particularly when you're in crowds or groups of people that you don't know or don't know their status. But I would encourage each and every one of you to get your vaccination. I'm going to do just a couple quick reports today. One of the things I wanted to caution you with, you might have seen Monday, there was a report of 0 cases in Daviess County. That's the case of not believing everything you read or you see. Understand over the weekend, our results at best are sketchy, and we had a couple of fairly large testing sites that failed to report. They made up for it yesterday. Now, the good news is when you take the 20 that was reported yesterday and the 0 and divide it by 3 days, we're down to, you know, like eight cases, 7 cases. And today we had a pretty good report. We had 13 cases. So on today, Green River Health Department reported that there were 40 additional cases in the Grad region. 13 of those cases were in Daviess County. We've had 10,487 cases, 182 deaths. The really good news is those confirmed cases aren't going up very, very quickly. The deaths are not increasing much at all. Up in the right-hand corner, you'll see where it says 35.98% of our community or our county has been vaccinated. That's of the total population. When you take out, and we'll get to that page here in just a second, but when you take out those who are not eligible for vaccination, those who are 16 and under or 18 and under, then we do pretty well compared to our sister counties. We're in that range of 45% of those eligible for vaccinations have had them. And I'm really pleased, those who are 65 years of age and older, we're at that 75% range. That trails the state as a whole by a little bit, but it's not too bad. State positivity rate has held steady, or actually it's trending down now. We're showing about a 3.15% positivity rate. We had been in the 3.5 to 3.75. If you look on the map that just popped up, Daviess County is showing 11.5 cases. That's active cases per 100,000 population. That's down from about 16 cases last week. So that's trending in the right direction. The state overall is showing 9.89 cases per 100,000. So we're still a little above the state. Couple things I would show, you'll notice Hancock County and McLean County are in the yellow. All the other grad counties are orange with the exception of Webster, and they've hopped back into the red. Most of those smaller counties, it doesn't take but 1 or 2 cases to cause them to go right back into the orange. I know Henderson has been up, and Webster County has been up because of some outbreaks in their jails still. If you'll go back to a picture of the entire map, go back to the pic, there you go. One of the good things that I can tell you is you look on there and you'll see 3 counties who are less than 1, around 0. Today, you've got 2, 4, 6, 7 counties that are red. I think yesterday or the day before, we only had 4 counties that are in red. But again, most of these counties that you're seeing are going to move back and forth between the red and the orange are yellow and green because they have smaller populations, and 1 or 2 cases will really cause a large jump. Do you have another slide for me, Jordan? This is from the vaccine or the CDC COVID data tracker. It talks about vaccinations in Daviess County, and it may be a little different than what the state reports or what we report. If you look, it says that 33.2% or 33,214 people in Daviess County have been vaccinated, and that's 32 or almost 33% of our total population. But if you look at the population that's eligible, that's greater than 18 years of age, 32,983 of those folks have been vaccinated, which is 42.9%. Now that's pretty good. The population that's not 65 years of age or older, we are at 71%, and that is I don't know that we've got any of our fellow. There was a map where you could go back and forth, but we're in pretty good shape compared to most of the counties. And when I say in pretty good shape, our percentages are higher. With more people, it's harder to get large numbers there. But there really is no reason for anyone who wants a vaccine not to be able to get a vaccine. We can provide transportation for you. If you go on, you can find a provider at vaccines.gov. We've got 43 providers in Daviess County. As I said, you can get free transportation just by calling the GRITS transportation system at Alderman area and give them 24 hours notice. They will take you to and from. I think right now everybody they're feeling a lot better. I know I continue to get questions. Reopen the county. No more masks. Well, that's easy for you folks to say, but that's not my call. That is the governor's call, and we are just a subunit of government under the state government, and they're the ones that are making those decisions. The cases in Daviess County, we've had, as I said, 10,487 cases. 2 are currently hospitalized. That's down from 3 last week. Again, we had 182 deaths. On this sheet, it shows 36% of our population vaccinated. If you look at it, but of the 21,925 cases in grad, right now the largest age group is the 20 to 29. There have been 3,633 cases there, followed by the 30 to 39, which is 3,500 cases, followed by the 40 to 49, which is 3,435 cases. The cases in those who are 65 years of age and older have trended sharply down, and that's good news in a couple of ways. That's a result of the high percentage or proportion that are vaccinated. And it also is one of the reasons why our death rate has dropped dramatically. 92% of the deaths as a result of COVID occur in our older populations and those who are 60 years old and older. Age range, believe it or not, 1 month to 102 years old. Just yesterday or the day before, the CDC authorized emergency use of the Pfizer vaccine in young folks as young as age of 12. I would encourage you to consider having your children vaccinated if they fall in that age range. It'll be particularly important in being sure that we can open the schools 100% next fall.